Okay. We will start with the refeeding syndrome station. I will share it now on my screen. Here it is. Okay, so you have 2 minutes. Just you're supposed to prepare it, so please you can have 1 or 2 minutes. Write down your notes, arrange your thoughts. We will start.
Doctor, I'm ready.
Ready? Okay, very
Yes,
clever.
sir.
I will start my time. Once, give me just. Let's say that my name is Christine. Okay,
Christine.
yeah, and the patient's name is
Sarah. It is written
Sarah.
in this.
Sarah. Okay, 1, 2, 3, go.
Hello, Christine. I'm Dr. Zainab, one of the mental health doctor. How are you doing today?
Well, I'm fine, thank you.
So I've gathered that you have some concerns regarding one of the patients, Sarah. And I really appreciate your concern, and I'm here to understand more about that so that we together can help her.
Well, during my routine follow-up, I just found that she's not doing well, though she has been gaining weight. You know, she has been diagnosed with anorexia nervosa, but I don't know, doctor. She has been doing fine the past 3 weeks. In the past week, she was not fine at all, and her condition is deteriorating.
Mm-hmm. Okay, so could you please tell me a bit more about her physical condition?
Well, she is very lethargic. She feels so weak, and her muscles, her limbs are edematous, and she says that she can't swallow. I don't know, doctor, what's going on with her. She was eating so well, and her mother was keen to make her eat as much as possible to gain weight.
That sounds really difficult. So, have you checked her vitals recently?
Yeah, her temperature is within normal as well as the heart rate, but the blood pressure is a bit lower than usual.
Mm-hmm. And apart from that, is she having any other medical condition that I should be aware of?
No, no, she doesn't have
Okay.
any other medical problems.
Mm-hmm. And was she assessed by GP recently?
No, no, she was not still assessed by the GP.
So I was just wondering, are there any steps taken so far, like any investigations done?
Yeah, we did for her the routine blood tests, blood chemistry. Everything is okay except that the phosphate level is low. I don't know what is the significance of this.
Mm-hmm. Okay. And do you have any idea what is her current weight?
Well, when she was diagnosed with anorexia, she has
Mm-hmm.
been about around 40 kilograms. Now, because her mother is keen to make her gain weight, she is
Mm-hmm.
now 45 kilogram within less than 1 month.
Hmm. And I was just wondering, is she following up with her dietitian regularly?
No, no, no.
Mm-hmm. And do you have any idea about her social circumstances, like any stressor in her life?
Only her mother with her. She is helping her, and she is very, very helpful.
Mm-hmm. Okay. Any concern about her safety? Like,
No,
has she ever expressed
she was cooperative as far as I know. She was motivated, but in the last week she is deteriorated.
any concern, maybe not wanting to carry on?
No, no, no.
Okay. So, Christy, from our discussion, it seems like she is suffering from the condition known as refeeding syndrome. Have you ever heard about it?
No, what is this refeeding syndrome?
So, it is a emergency medical condition, which happens in patient with anorexia because they are starved for long time. So, when they are starved, they usually depend on fat for energy.
Yes,
And when they suddenly starts to eat a lot, their energy shift a bit, their source of energy shift from fat to carbohydrate. Am I making sense so far?
yes, yes, yes.
Yeah. So that leads to sudden increase in insulin in the body,
Yeah,
so which create chemical imbalance and also change in electrolytes. So in her case, as you mentioned, her phosphate level is low,
yes, yes, yes.
and
This is
it also
really,
leads, yes, it
yeah.
is concerning. And also thiamine level also comes down. Other salt like potassium and magnesium also comes down.
Why is her, she has difficulty in swallowing and her limbs are swollen?
Yes. So as I mentioned, as a result, her muscles also become weak, like the muscles of swallowing, they become very weak, so they have difficulty in swallowing. And their heart muscle also become weak, so their BP also fluctuate. It drops.
Yeah,
Am I making sense?
yes, yes.
And on the long term, it can also lead to some kidney dysfunction, like some salt water imbalance.
Okay. So, doctor, so how can we help her?
Yes, so before I explain you about how we are going to help her, just to recap that she is having this anorexia nervosa, and currently she has been diagnosed with refeeding syndrome. In the background, that her physical condition is not stable at the present, and she carries a risk if she will not manage on time. All in the background that she is not having any other medical condition or any other psychological stressors, and
Sure.
she's not following with the dietitians. So
I
and
see.
her family, her mother also needs some understanding how to help her. And
Okay,
as far as management is concerned, so we always work holistically as a multidisciplinary team, and by that I mean me as a psychiatrist, the psychologist, the dietitian, the social support system, and community mental health team.
yeah,
So
okay.
I understand that refeeding syndrome is a medical emergency, so we have to admit her in medical ward as soon as possible.
I see, I see. Well, definitely this must be done. Yes.
Yes, so we will liaise with the medical team, and basic blood reports will be done, like liver function, kidney function, and ECG, the heart tracing. But the backbone of the treatment will be to improve her general condition and make her vitally stable.
I see, I see. One
How does
minute
that?
remaining.
Yes. And we will also we will also keep her in touch with the dietitian who will help her to make a good diet plan, healthy and balanced diet plan, so that she don't gain more than half to 1 kg per week.
I see, I see. Yes, this must be done because it seems that eating has made a big problem. Yes.
Yes. And once she is medically stable, the psychologist will come into picture for talking therapy, because
Yeah,
that will be the mainstay of treatment. And
yeah.
the family member, we will also educate about the illness to family members so that they can help and support her. And
Yes,
the community psychiatric nurse will follow them up regularly if there
yeah.
are any other signs, so they can identify and they can come. How does
Okay,
that
very,
sound?
very helpful. Time. How do you feel about what you did? Excellent, mashallah. How do you feel about what you did?
I think, I don't know, I have missed something. I
Give
want
her
to
some
explain more
feedback.
about.
It was very good. Very good. But when I asked you about the swollen legs, just talk about the kidney dysfunction because of the chemical imbalance, and this led to water retention. Always in
Mm.
your management say that you are going to see her and speak for her. Don't have this authoritative approach to the patient, towards the patient, which you are going to put him here and there without talking and explaining this to him. There is a point for those who pay attention to the patient's health view. So whenever you are going to talk with about the management plan, make sure that you mention that you are going to talk with the patient and explain the condition and the management steps. Other than this, it was very good. I didn't have any. MashaAllah, very good, very good. Even our colleagues, nobody gave you any feedback which can be negative, and all of them are experienced psychiatrists. And pay attention to whatever they are going to say. I don't want to get in this specific situation, but most important is active listening. Yeah, well, active listening, if you are talking to a family member who is suffering from something, or the patient suffering from here, when we do the management, the active listening is not the base here. Okay, maybe active listening is more in the history taking and the mental state. Okay, so let's see according to the PDF. Yes, so again, you are not obliged to follow my PDF. You are all experienced, choose whatever source is suitable for you, but make sure that you are going to score enough to make you pass in the mark sheet, which we are going to see. So here in the station, you are talking to a nurse, so make sure that the first thing you do, as we always say, is to take a handover. And simply the handover is the biopsychosocial information and the management steps done so far, because you are talking to someone who is delivering the service, is your colleague. So you want to know what are the steps done so far. And in this scenario, there has been some blood tests which showed that there is low phosphate. So the candidates who do not pay attention to the management steps, they might miss that this blood test. There are some abnormal blood tests, and the role player is not going to volunteer to say it to you. You must ask, what are the steps done so far, to make sure that you are going to cover all the points needed to make sure that you took a handover, and you must articulate it. You must say, I would like to take a handover. This is how you talk with a colleague. I want to take a handover. When you talk with a nurse, or if you are talking with your colleague doctor, you must take a handover about the patient, which the information, simply the biopsychosocial and the risk. Then explanation of the diagnosis. Again, this can be a bit tricky for some of the candidates. They don't know how can they explain the refeeding syndrome. Simply just mention that she has been dependent on fat as a source of energy, and the rapid shift to the carbohydrates caused the chemical imbalance. If you want to talk about the insulin, okay, but this can be considered as medical jargon. You just say that she is dependent on carbohydrates. This caused chemical imbalance, okay? Like what? Like the decrease in the level of phosphate, magnesium, potassium, and thiamine, okay? By the way, you did not mention that the patient should take thiamine in the management. Okay,
yes,
so yeah. And this, according to, because of this imbalance, there will be weakness of the muscles of the heart, the muscles of the swallowing, okay? And also this chemical imbalance will cause swelling of the limbs because of the water retention. Don't forget to do the formulation, please, like what Dr. Zainab did, because we want to, as I said, we want to score every box in the mark sheet. And as for the management, again, doctor, don't forget to say that I'm going to talk with the patient, and you will see that there is a box for the patient, for the candidates who are keen to talk with their patients, not to lecture about the management or have this authoritative approach. Okay, so this patient is going to stay in the medical ward as what Dr. said. Dr. Zainab said, and once she is there, she is going to do some blood tests. And the backbone of the management is that she is going to have the thiamine and the correction of the general condition of the patient. This is the backbone and the electrolyte imbalance, okay? And then talk about the biopsychosocial. And here, don't forget the social, that your management plan must include the psychoeducation for the family. Otherwise, you did not do a proper management, because the problem here is basically the misinformation of the wrong information which the family has. Okay, and definitely the dietitian. It is a very simple and straightforward station. The problem in this particular station, that the candidates forget the family psychoeducation. They have a trouble in the explanation of the refeeding syndrome, which reflects their ability to simplify, and it reflects also their understanding. So when they are struggling to explain, this means that they don't understand well what is the problem. Okay, and also, like what did our colleagues did the mistakes, she forgets the thiamine. Usually they forget the thiamine. Okay, other than this, everything was okay. And also they forget to take a handover. This is how you start talking with every colleague or every caregiver. Now, again, this is everything. This is the bottom line. This is the mark sheet, which will be in the hand of the examiners. And this is how you should prepare whatever your source is. Make sure that you are going to score for yourself enough in these boxes to pass. Okay, and as you can see, there are 6 points for the communication. So whenever you are practicing, make sure that you show empathy. You show what is known as the appropriate reciprocal emotional interaction. So if you are talking with a nurse or a role player who is showing some concerns, don't be cold, don't be formal. Show some appropriate emotional response, something which we know as empathy. Okay, so let's have a look at this mark sheet. As you can see, the first point to be scored for you is the formulation. And unfortunately, the candidates have a problem in formulation. I hope that you have a look at the video of formulation in my YouTube channel and practice to do the formulation for every management station. The significance of findings and results, Dr. Zainab identified them. Management plan was good, but again, because you did not talk about the thiamine, I don't know, maybe this point might or might not be scored for you. Does not pay sufficient attention to the patient health view. Again, see this point, the candidates who talk about the management starting by saying, I am going to explain the problem for the patient and explain the management, definitely they are going to score this point for them. Unfortunately, Dr. Zainab, though she is clever, she did not score this for herself. Risk management, she did. The psychological and social interventions, both of them, she mentioned them. Everything regarding her communication skills were good, except that she was very formal. I did not feel that she had this, Okay, I hope that you found it helpful. And again, doctors, whenever you are revising, try to refresh your memory about the subject of the station. This will make you more confident. You don't need to go through the textbooks. Just go through some helpful educational images like this. Okay, this will make you definitely more confident when you are talking about this station. I hope that you found it helpful. Okay, very clever, Dr. Zainab. So even our colleague, yeah.
Because she was nurse, okay, we can mention about insulin because she understands what insulin.
Okay, just but okay, no problem.
Thank you, sir. Thank you so much.
Okay, so who would like to go next?
Yes, I can do. Okay.
Okay. Dr. Santos. Oh yes, how are you, my friend? So what is your station, doctor?
It's managing negative symptoms of schizophrenia.
Yeah,
Psychosocial intervention.
This is a new station, and the pass rate is not good at all. Okay, just give me. Okay, take your time. Good luck, man. Okay. This is one of the stations whose the outcome is not good. So have a good look at it, okay? Please, I will give you time to read it and read the role player notes, so you will all have 4 minutes in order to make sure that this station is clear for you, because the passing rate in this station and the feedback from the candidates that most of them did not do well in.
I can go, Dr. Hussain.
Yeah, okay, brother. Very clever, I know, but I want to give the candidates just a chance to have a look at this difficult station. And you are all lucky that Dr. Santosh is the one who's going to do this station. Okay, so just give them just a few minutes to read the role players' notes. And please, doctors, there are some sources out there which do not include the role players' notes and the scenario. Please don't do this. This will help you. When you read the role players' notes, you'll feel more comfortable, because you will know the dialogue and what the role player most probably is going to say. Okay, otherwise everything is going to be vague, not enough to have an approach without knowing what is going to be happening in the station. Okay. Okay, doctor. So we will start now. 1, 2, 3, go.
Hello, I'm Dr. Kumar, one of the mental health doctors. How shall I address you?
You can call me Sally.
Sally, how are you doing today?
Well, everything is okay. I don't know why they asked me to talk with you.
Sally, I understand that you have come to this nursing home, and some of the staff, they are concerned that you have not been able to engage in the activities in the home. And I'm here to understand more about you so that I can help you. We as a team can help you in best possible manner.
Okay.
Okay? I understand that you have been diagnosed with schizophrenia and recurrent depressive disorder, and you have been prescribed with 400 milligram of clozapine and also 200 milligram of sertraline. Are you taking your
Yeah.
medications regularly?
Yes. Yes. Yes.
Okay, and how are you doing in terms of your mental health?
Well, everything is okay. I don't have any complaints.
Right? How your mood is?
Everything is okay.
Okay, are you able to enjoy things which you used to enjoy in past?
Well, I used to enjoy things which are not available. That's it. That's the problem. I used to
Mhm.
have a career, but now I don't have any career.
Can you please tell me more about that?
I was supposed to be an engineer. Now I don't think that I can have, pursue this career anymore. And this is what was my dream. So you're asking me if I'm able to enjoy the things. I want to enjoy them, but they are not there. They are not available.
Right, Sally, thank you for sharing that. And I can understand that things can be difficult once people don't find things which they really interest in. So, if you allow me asking a few more questions, how do you find this nursing home?
Well, I'm staying in my room. That's
Mhm.
it. I don't bother anyone.
Okay, and how do you find the staff over here?
Everything they are good.
Actually, I brought his note, you know.
Serious lah.
Yeah,
And
Chenzi
what are your
Day. I
thoughts
can
about the
just
activities which are there in this nursing home?
Well, I'm not keen to join the activities. I'm not there.
Okay, why? What goes on in your mind once you are asked to participate in these activities?
I don't feel that I'm motivated to do this.
Right? Okay, so you don't feel like motivated, and finally you don't come out of your room, right?
Yes, yes.
All right. Okay. So, mm, coming to your home, who else is there at home to support you?
Well, actually, there are no. I don't have any family now. My mother and father have passed away.
I'm really sorry to know that. Please accept my condolences. So, I was worrying. Before coming to, before being diagnosed with schizophrenia and recurrent depressive disorder, did you have any hobbies too?
Yes, I used to walk. I used to go to the gym.
Okay, okay, that's good. And do you have any plans for your future once you go back home from this home?
As I said, my future was to be an engineer, but now I don't
Right.
have any future.
Thanks for reminding me that again. So now let me have some understanding about how you get along with other people. Do you like meeting people on your own?
No, I prefer to stay in my room.
Okay. And are there some things which you want to come forward and do on your own?
No, no, nothing in particular.
And do you find anything which is pleasurable to you?
No, no,
All
nothing.
right. And do you like to speak up your mind and go to people, approach them?
I'm not a person who speaks too much.
All right. Okay. So I know that things have not been easy for you. Have you ever thought of ending it all?
No, no,
Or any thoughts of harming any of the staff over here?
no, no.
All right, okay. So, after talking to you, Sally, it seems to me that what you are having currently is negative symptoms of schizophrenia. Have you heard of it?
No, what is this negative symptom?
Most of us, we have some functions, and in those who are experiencing negative symptoms of schizophrenia, they lack those functions. For example, in your case, you don't like coming out, you don't like talking to people, you don't like socializing. Am I right in saying so?
Well, I just don't feel that I am
Yeah.
this type of person. That's it.
Yeah. So, I can understand that it's not easy and it's a difficult state you are in. So, if you don't mind me just to recap things, I like to say that currently you have presented with negative symptoms of schizophrenia and you have been diagnosed with schizophrenia and depression in past. although there are no safety concerns. And unfortunately, you don't have much of psychosocial support. I mean, much of support also way back home, right?
Yes, yes, yes.
So we, as a team, can help you with some of the interventions. Will you like to know more about that?
Yes, yes.
Right. So we can help you developing some common life skills like helping you with some cooking, cleaning yourself, managing your finances. How does that sound?
Sound good, but I can clean myself.
Okay, that's good to know. But they can help you with some other skills like socializing, making social networks, making more friends.
One
Will
minute
that be okay?
remaining. 1 minute remaining.
Yeah.
Okay.
And the team can also help you finding a job once you are discharged from this home.
But
And
doctor, I feel that I still am not able to have a job.
all right, so we can help you completing your studies and then finding a job. How does that sound?
I don't know, doctor, if I'm able to do this.
All right, please don't worry. We'll try our level best to help you, and I hope that things can be better for you. Let's stay hopeful.
Okay,
We
doctor.
can also help you with pursuing some hobbies like you wanted to go to gym, so we can provide you with some equipments. And there are some talk therapies called cognitive behavior therapy. Have you heard of it?
No, I did not.
So in cognitive behavior therapies, we will be identifying your unhelpful thoughts like
Fine. Okay. How do you feel about what you did?
maybe I
As
was
I
too
said, this
fast.
is not,
Yeah,
though Dr. Santos is clever, but still, we will see that there are some points in the management. I hope that you all pay attention to this. I did a hard job to gather these points in the management, so if just write them down. So let's see, according to the mark sheet, how does this station go on? So everything was okay in your performance except regarding the what are the technical steps which you are going to do to tackle the problem of negative symptoms. So in the beginning, as you can see, there is a big story here, a very, very big story, a lot of information which you should gather from the patient. Okay, so how we do this, we start by gathering the biopsychosocial information and the level of risk, ask about the condition of admission, he asked about the psychological condition, nurse, the social information regarding the residential home and her family, the physical condition and the level of risk. In this station, the role players is instructed to talk in a monotonous way. Those who have negative symptoms, they talk in a very monotonous way. Okay, don't mistake me as a negative someone. I talk in a monotonous way, but they have paucity of speech and very monotonous way. They have this telegraphic answers. Okay, so comment on this paucity of speech and say that seems that you use few words to express yourself. Okay, so this is the first trick. The role player is going to use very small words and you should address this. Now, when you explain the negative symptoms, you must mention what are the negative symptoms. We have alogia, we have apathy, we have asociality, we have avolition, and we have anhedonia. Okay, from our discussions, it seems that you have negative symptoms. Have you ever heard about these terms? This means that you have slow thinking reflected by the use of few words. This is alogia. And your mood is not reactive. This is something called apathy. And you are not engaged in personal social activity. This is called asociality. And you have low motivation and don't care enough for yourself. This is called avolition. And you seem not to be interested in many things. This is called anhedonia. Anhedonia does not mean that she has depression. There is also anhedonia related to this psychotic problem. Okay, are with me, Dr. Santosh?
yeah, yes, Ram sir, I'm hearing.
Yeah, Dr. Malik is giving you a very good feedback. So now the formulation, you did the formulation is very good way. Now let's go to the management steps, which is the tricky part. Okay. So this lady, if you just took her to a workplace, she doesn't know how to work. So there are some fundamentals which she is missing. Okay, are you with me, doctor? So how we are going to tackle her problems? You, Dr. Santush, as we always say, are going to assess her regularly to follow up her level of condition, level of risk, and address all her concerns. And there will be a psychosocial plan. What is the role of this plan? To improve the quality of life by improving the brain functions and social functions, which are negatively affected by her mental illness. So this is how you introduce your management plan. So what are these things which you are going to do? We have cognitive enhancement therapy. This is done under this. Please write this down or just have a screenshot. You will not find it anywhere. That's why there is low passing level in this station. Okay. You have the cognitive enhancement therapy. Okay, this is done under supervision of a coach. It includes computer programs to improve the attention, the memory, problem-solving skills, and executive function. So this is the first thing, the cognitive enhancement therapy. Now, the second thing is the social skills training. We need to improve her social skills. It will include the use of verbal and non-verbal communication, improve the self-expression. There will be group exercises to improve the skills and the ability to relate to other people. Okay. Then what you have mentioned is something called vocational rehabilitation. Okay, what you have mentioned is something called vocational. Just use the appropriate terminology. Okay, vocational rehabilitation. These are programs which promote good work habits and independence. Okay, are you with me, Dr. Santosh, so far?
Yes, sir.
Okay, so family intervention. Well, I just put it here just to include it among. These are the steps. These are the points of the psychosocial support for this patient. There is no family intervention, but generally speaking, there is family intervention. Psychoeducation about the illness and the proper ways to help the patient. This is also part of the support for the patients who have negative symptoms. And finally, the CBT, which we all know. Okay, so
Sir,
this
I
is,
was wondering,
yeah.
shall we name vocational rehabilitation, or shall we say it in simple words that will help you finding a job
Yes,
that suits your
not
abilities?
help you to find a job. It is written here. There is also vocational rehabilitation, which helps you to have good work habits and independence. This is a simple sentence to explain what is the meaning of. This is a simple sentence here to explain the meaning of vocational rehabilitation. Okay, then family intervention and cognitive behavior therapy. So we have 5 points, 5 technical points in your plan to manage the negative symptoms of someone who has the plan or for those who have negative symptoms. Okay, so and again, doctors, refresh your memory with some of these educational images. We have fear, positive, disorganized, and negative symptoms. These are the negative symptoms. Okay, and again, let's have the mark sheet, see the mark sheet. So the mark sheet here, Dr. Santosh, you did formulate the problem effectively. You recognize the finding, the result. Unfortunately, your management plan was not good. So I don't know what would be the magnitude of this point, because some of these points, the score, the magnitude of can be very big, and because you did not score 1 point, you might not pass. So I don't know. I'm just telling you how to use this mark sheet. Does not pay sufficient attention to the patient's health. You know you did this. Risk management. And the good thing that though this is a station of negative symptoms, you did talk about the risk, very clever. Psychological and social interventions, I cannot say that you talked about them in depth or appropriately. So point number 6 and point number 3 might not be scored for you. As for the communication points, and pay attention to communication points, he has good communication, Dr. Santos, for them all. Okay. Again, doctor, this station has low pass rate, very low pass rate, unfortunately. Maybe because the material there is not available. Okay, I had to prepare it myself. Okay, just make sure that you cover the station appropriately. Thank you so much.
Thank you,
Okay,
sir.
I hope that you found it helpful.
Yes, sir.
Okay, thank you. Very clever. Okay, so who would like to go next?
Yes, Dr. Hussein. Amr Hafiz.
MashaAllah. What is your station? Please open your cam, or if you prefer to not to. MashaAllah.
No,
What is
it's okay.
your station? What is your station?
ADHD management.
ADHD management. Yes, this is a very common station, and pay attention to the statistical figures which you should remember in this station. Okay. Okay. I'm ready whenever you're ready, doctor.
Okay, let's go.
Okay, pay attention that as you can see, they are instructing the role player to appear concerned. You know, they are instructing him to show some particular emotions. Pay attention to this. You should show the appropriate reciprocal emotional interaction. Pay attention to your communication, doctor. The exam is not an oral exam. It is an exam to challenge your consultation skills. Okay. So let's start. Let's say that the child's name is Michael and my name is Mr. Brown. Okay, 1, 2, 3, go.
Hello,
Hello, doctor.
my name is Dr. Hafiz, one of the psychiatrists here. Are you the father of Michael?
Yes, yes.
How can I call you?
You can call me Mr. Brown.
Nice to meet you. Mr. Brown, I do understand that you have some questions regarding the diagnosis of your son.
Yes, the
Can you
school
share it
said,
with me?
yeah, the school said that we will not accept him if he will be assessed by a psychiatrist. What is wrong with my child, Michael?
I can see how much you are concerned about him. After assessment of your child, we have a diagnosis called attention deficit hyperactivity disorder, or you can call it ADHD. Do you have any idea about it?
No, what is this ADHD?
This is a disorder that affects children around the age of less than 7 years, and it affects usually boys more than girls, and usually it affects the behavior of the children to make it hard to control the behavior. It usually affects the concentration, that affects the education, and usually and also make the children more impulsive, that put him at risk. Am I clear so far?
Yes, yes. Is it a common problem, doctor?
Actually, it affects boys more than girls. Boys affect about 3 children every 100 in the UK, and for girls, it's about 1 every 100 children.
I see. Well, I have my wife is pregnant, 8 weeks pregnant, and I myself, someone said that I might have ADHD. I'm wondering what are the chances to have another child with ADHD?
Thank you for asking this question. I would like to ask you some questions regarding your child, Michael. Is that okay?
Okay.
So, is there any family history in the family, including
Yes.
you, his mother, his
No,
brother?
no. But when I discussed this issue with some doctors, they said that I myself might have ADHD, but I didn't understand what they might talking about.
So, do you take any medication for this?
No.
Okay. So let me answer your question. That usually, if one of the family members has ADHD, usually it runs in family. About 30 to 50% of the parents who have ADHD might have one of his offsprings have ADHD. Am I clear so far?
Yeah. See, what is the cause of ADHD?
Well, usually it runs in families. However, also there are other possible causes. One of the causes is the chemical imbalance, and also other factors may affect, including if the child has been born prematurely before 37 weeks. Also, if he has any kind of epilepsy, or if he has any kind of brain injury.
So, any blood test to diagnose it?
Unfortunately, ADHD cannot be diagnosed by blood tests. However, we diagnose it using interviews with the family and with the child himself, and taking some reports from the school or the KG. Am I clear so far?
Yes. Do you think that he will get better?
Well, this is a difficult question. However, there are some factors that may affect this. Of course, early start of the treatment make him has good chance of getting better. If he has no family history, also make it good. And if he has no medical problems, no past psychiatric history.
Okay. So how are you going to help him, Doctor?
Well, let me highlight some points that is important in our management plan. I can see that Michael has a problem called ADHD, which is risky if not managed. And also he has might have positive family history of ADHD, but I can see that he has full family support from me. So in the beginning, I would like to see Michael again, and also to follow him in a child and adolescent clinic. Is that okay? And also, I'd like to do some further investigations or tests, including his birth, his weight, and the length. Is that okay?
Yeah.
Am I clear? Okay.
Yeah.
So, in addition, I'd like to involve him in a multidisciplinary team, including for psychological, social, and also physical.
1 minute remaining.
I will try to give him a medication called methylphenidate. Have you ever heard about it?
What is methylphenidate?
This is a stimulant to the brain, stimulant to some centers of the brain responsible for concentration and attention.
But he is already stimulated, doctor. See, how come you are going to give him a stimulant?
This medication corrects the chemical imbalance in the brain and stimulates the centers responsible for concentration and attention that might correct his condition.
I see. So does it have any side effects?
Unfortunately, every medication has its own side effects. This includes vomiting, headache, sometimes sleeping problems, and appetite problems. And
I
growth,
see.
sometimes it might cause growth problems.
Does it affect the liver?
No, methylphenidate is not digested by the liver, so does not affect the liver.
I see. Okay.
Do you have any
Thank
further
you.
questions?
Thank you. Thank you.
You are welcome. Thank you.
Very good, except that you need to be more fluent. You know, the simple pauses between every word, you might not pay attention to them, but if you say that you used around 30 sentences, if you added in every sentence 1 second, you wasted between 20 to 30 seconds because of this non-fluent dialogue which you are doing. Everything was good. I'm just telling you that you have, in order to manage the time properly, try to be more fluent. Okay.
Okay.
Everything is okay. Pay attention that when you talk about the blood test, what blood tests, make sure that you talk about the kidney function, liver functions, and etc. Okay. When you signpost for the formulation, say that I would like to highlight the most important points which we are going to focus on in our management plan to make the formulation related to the question of how we are going to help him. I don't know if the epilepsy is more common with the ADHD. You mentioned epilepsy. I don't know. Maybe you
I
have a
searched for it
source.
in the NHS website.
Okay, maybe you have it. I did not read this. It was very clever,
I
mashallah.
will
Let's see.
review.
Okay, let's see the station. Okay, so let's see. So pay attention to the figures. It is a very common disorder in the child and adolescent psychiatry. Maybe the most common problem. So pay attention to the figures. This developmental disorder 3 times more common among the boys. Okay. 1 every 20 children will have it. You can say 3% of the boys and 1% among the girls. Okay, no problem. So when he asks you about the chance of having, this is a question which the candidates also find it difficult to answer. I gathered the statistical data which can help you to tackle this question. The story goes that his wife is pregnant now, and the father is having ADHD. So what is the chance of the coming baby to have ADHD? So you can say that runs in families, 3 out of 4 children who have ADHD have a family member who have ADHD, and the risk increases with the family members who have this problem. You can say, roughly speaking, that 1/3 to 1/2 of the patients of the parents who have ADHD will have a child with this disorder. And if the older sibling has it, the next child has more than 30% chance. Okay, I hope that this statistical discussion is clear. This is a common question in this particular station, and unfortunately they can just stumble or say wrong information, which is deal breaker. Okay, you can, if you don't know a particular situation, don't give wrong information. If the role player asks you a question and you don't know the information, you can say that I'll go to check the sources and I will come back again to you with the right information. Okay, don't say wrong information. Okay, what are the causes of ADHD? Did you talk about the alcohol intake and smoking during pregnancy?
No.
What?
No, I did not.
Well, this is also a mistake. This is the most common cause of having ADHD. Alcohol intake and smoking during pregnancy. Yes, the family member is a common issue, but the more common is smoking during pregnancy and alcohol. Are there any blood tests? We answered this question well. Formulation did formulate well, and the management, where she's going to be treated, everything was good, but please, again, don't say we are going to do blood tests. Blood tests is very, very broad issue. What blood tests are you going to do? You answered the questions about the side effects very good, and also does it affect the liver? If you want to add a cherry on top, mention that there is another medication called Strattera, which affect the liver. Okay. Is there any special diet? This is a common question. So mention just generally speaking, there is no definitive ADHD diet. However, adopting healthy eating habits is the best way to elevate the mental and physical wellness. Okay, increasing the intake of fruits, vegetables, whole grains, and healthy proteins while limiting sugars, refined carbs, and saturated fats. Okay, these are the good family, good diet for the child. Okay, and in the management, please, doctors, do not forget the family psychoeducation. Okay, and I just pay attention to the social because it is very important. A child who has the ADHD, you should do family psychoeducation and an appointment with the social services to contact the school special educational coordinator. Okay, because the school must be informed, and the story goes that he had a problem in the school. That's why he has been referred to. Okay, so socially, you did not talk about it, unfortunately, though you are very clever, but you did not talk about this social approach, which is very important. Family psychoeducation and the school special education coordination. And finally, termination. Okay, let's see the mark sheet. You did formulate effectively. You recognize the significance of finding and results. The management plan was good. You did pay attention to all my questions, and for the risk management plan, did you ask me about the risk? You did not ask me about the risk, so this point might not be scored for you. And you did not mention the social interventions, so these 2 points might not be scored for you. And because of the poor time management, the point number 7 might not be scored for you. But all in all, it was very good, by the way, very clever. Thank you so much, Dr. Am. Very clever, mashallah. So who would like to go next?
Yes, doctor, please.
Yes, okay, doctor. So what is your station, doctor?
Schizophrenia and cannabis misuse.
Okay, give me this. This station has a very big candidate notes, man, very big. I just tried to summarize it here in points to help you to tackle this station. I don't know why do they do this, but very big. So, some said that this exam is formulated for the candidates who are able to score not less than 7 in the IELTS. That's why they put some big reading materials for the candidates who are able to read fast because their linguistic abilities are good. I don't know, but this is one of the stations who have very big reading material, and so try to tackle it here in this abbreviated or summarized notes, and because it can be summarized simply and you can finish it in 2 minutes if you paid attention to these points. Okay, so let's start. Have a good look at the candidate notes and role player notes, and I will scroll up after 2 minutes. Okay, 1, 2, 3, go. Okay, can we scroll up, doctor?
Yeah, we can start.
I hope that the story is clear for you. So this man has been diagnosed with schizophrenia 5 years ago, and these are the symptoms. The first attack, okay, he has been improved and returned back to the college. Another attack happened 3 years ago due to stress and use of cannabis, managed at home by olanzapine, okay. And now you have 2 weeks of the current episode, okay, 6 weeks, okay. These are the symptoms of the current episode, and these are the level of motivation, okay. Points related to the level of motivation. You will not find this station with this presentation in your notes. I tried to summarize it because it was a salad of symptoms and don't know exactly where to go from the information you have. Ready, doctor?
Yeah, doctor, okay.
1, 2, 3. Let's say that my name is Michael. 1, 2, 3.
Michael.
Okay, 1, 2, 3, go.
Good afternoon, Michael. I'm Damiana, a psychiatrist of mental health team. How are you?
Fine, fine. I don't have any problem.
Sorry?
I'm fine. I don't have any problem, doctor.
Yeah, I have been asked by your GP to talk with you about what you experienced recently so as to find way to help you. Is that okay for you, Michael?
Well, it's a problem. I don't have a problem. They are my colleagues. They are not
Oh,
good, and they are influencing my manager. And you know, they are sending messages to me indirectly by the way they park their cars. And I discussed this with my GP. He said that I must talk with you, though.
It sounds to be a difficult time for you. Could you tell me for how long did you experience it?
Well, this started about 2 weeks ago, but you know, I'm very concerned about. I stopped looking from the window, though, to avoid receiving these messages.
Okay, and how do you know that you receive messages from when you open the window? How did you realize it?
I know that they park their cars in a particular way, doctor. They send signs by the car, you know, they park their cars together, you know, perpendicular to each other, you know, creating letters. They are sending these messages to me.
There may be other explanation for that?
No, and even my manager is affected. They controlled him, doctor.
And apart from that, do you think that anyone else want to harm you?
Well, I know. I'm a peaceful man. I just avoid them. I know that they are up to something, but just I don't want any problem with that.
Some people, when they are distressed, may have some unusual experiences. Do you have any of them, Michael?
Like what?
Like hearing voices no one around can hear, or something like that.
Yeah, I hear sometimes. I hear them talking and whispering about me. Even when I am at my home, I don't know how.
Do you have any explanation of these voices?
Well, just emphasizing that they are up to something, doctor. This is what I can say. Okay.
My understanding, Michael, that you were diagnosed previously with paranoid schizophrenia, right?
Yeah.
Do you think that what you experience right now may be related to the symptoms of psychosis?
No, doctor. I'm sure that this is happening. They are sending messages to me, and and definitely I must, you know, avoid them, and I'm taking precautions. I don't look from the windows, and I try to control these voices by my own way.
It sounds to be hard time for you. I need to double check for you about some points before talking about how we can go forward. Is that okay, Michael?
Okay.
My understanding that you were on olanzapine previously. Could you tell me how do you find it as medication?
No, I stopped taking it 6 weeks ago, though.
Could you tell me why?
Well, it is a bit embarrassing, doctor, but you know, this is not the first time that this medication caused this problem with my girlfriend. She left me, but because of it, doctor.
Could you tell me more about the problem just to
You
find
know,
a way to help
it
you?
affects the man's ability, you know, and the
Oh,
erection
yeah,
and so
yeah.
on.
Thank
So,
you for sharing me that. Yeah.
yeah, I'm a bit, yeah, well,
Thank you.
you
I
know.
appreciate that. And apart from that, did it help you as regard your mental health?
Yeah. I was taking it, everything was fine, but you know, there are things in life which, you know, which
Mhm,
everyone must put it in his concentration.
mhm. And what about drinking alcohol? Do you drink alcohol
Occasionally,
or taking any illicit drugs? Or
I smoke
staying home?
cannabis. It helps me with the voices, doctor.
Mhm, mhm. It helped you. Could you tell me how it helped you?
When I take cannabis, the voices, you know, I control them. I don't hear them.
So for how long, Michael, do you take cannabis?
I've been taking it a long time ago, doctor, more than 10 years now.
Could you take me through a typical day of taking cannabis, if you don't
Well,
mind?
I smoke about 5 cigarettes every day.
Mhm, mhm. And what about your social life? With whom do you live right now?
I'm living alone, though.
Do you receive any kind of support from anyone?
No.
Yeah. And as regard your work, what do you work for a living?
Well, I'm working as a clerk in a company, but I don't go there now because of the colleagues.
Mhm, mhm. Thank you, Michael, for sharing me that. Just to recap what we are talking about, it sounds from our talking that you re-experience symptoms of psychosis again, and it sounds that it's related to stopping medication because it sounds you stop medication and after that you experience the symptoms. Moreover, you take cannabis at the moment. Just to ask you to be sure that you're safe, you think about harming your colleagues at work,
No.
harming yourself.
No.
Yeah. Actually, we in our management, we address many areas, the area of medication and psychological treatment as well, and we consider
1
the
minute remaining. 1 minute remaining.
so it sounds that you get benefit from olanzapine before. So what about starting it again? I know that it caused you some problems,
No,
but
I don't want. I don't want to start this again.
I understand your concern. But we need to investigate more because this sexual problem may have other background. So we need to do some blood tests to investigate more for that and to discuss other
But
alternative
what
medication
are the blood tests which you want to do?
like hormonal assessment to check about the level of hormones, liver and renal function, check for diabetes, something that may affect the
Excellent.
sexual ability.
Excellent. Yes.
Other
Okay,
point,
doctor, I'm okay with that.
cannabis may affect your getting benefits from the medication. So what about liaising with drug and alcohol services as a trial to stop it? What do you think
Good.
about that?
Very good. Okay. Time. How do you feel about what you did? Very good,
I
inshallah.
need to talk about management earlier than this to have more time.
Yes.
for you.
You wasted too much time in the beginning.
It's my problem almost always.
Yeah, the way with practice you will improve. So everything was okay, except that you should have mentioned when you talked about olanzapine. We have another option called aripiprazole.
Yeah,
Has
yeah.
less
I need to
propensity.
talk about that.
It was in the context. I don't know why you didn't do this. Okay, you mentioned the alcohol and substance misuse yourselves, which is very good. And that's it. Everything was good. And you just missed the aripiprazole. And other than this, everything was okay. and even the investigations. And good that you know that behind this problem of, this sexual problem, there can be also other things other than the medications. There can be high blood sugar level. Good that you mentioned this. I ask you to see if you know, but in the exam, the role player is not going to ask you. You must show it to the examiner. So there could be other causes for this problem, like high blood sugar level. You want to check it. Particular hormones behind this, like prolactin. I will give you leaflets about it also. We would like to check its level. See, this is how we talk about the blood test. Again, don't say blood tests in general. And okay, so, but all in all, it was very good. So let's see.
Thank you.
According to this Schizophrenia and Cannabis. This is one of the famous stations, unfortunately, also. Well, well, actually, most of the stations, basically, the stations of the management, the passing rate is not good. So in this station, you need to have good time management, because as you can see in the beginning, you need to take some information, history taking. So you start by gathering the biopsychosocial and take the complaint in the beginning. You want to know the onset of his problem, how did it all start, okay, and the cause, if it is increasing, related to the psychological symptoms which is having, and anything prevents them from harming him if they want to harm him, okay. And then ask him also, this is how you take the complaint, doctor, because I felt that in the beginning you wasted time because you're disorganized. So you want to know the onset of the disturbance of his mental state and the cause. Is it increasing or no? And what did they do? What did he do? And before the onset, you want to know how was he doing before the onset? He has these symptoms started X weeks ago. How was he doing before that? Were there any stresses? Was he taking his medications? Any use of substance or alcohol? Okay, so this is how you check how was he doing before the onset. And this is an area which the okay, Dr. Aini, just bear with me, please. This is an area which the Royal College, I gathered that it is paying attention to this area because this is the area of predisposing factors. They always give a better chance for the candidates who are paying attention now to that the patients have predisposing, perpetuating, and precipitating factors. Okay, so we have here, when you ask about before the onset, how was he doing, and you ask about the possible precipitating factors, okay, definitely you will pick up that this patient stopped his medication and also he is taking recreational drugs. And ask him about the symptoms of schizophrenia. You don't need to go deep in these symptoms, just you want to know the persecution and the perception enough, because this man is already diagnosed with schizophrenia. Okay. The rest of the information which you need to cover in the beginning, you want to know his social circumstances, the medical, and very important, doctor, to ask about the level of risk. Okay. Did you ask about whether he wants to hurt himself or anyone else? Dr. Demiana, did you?
Sorry, doctor.
Did you ask about the risk?
Yeah, I asked him if he think about harming his colleagues or
okay, very
harming
clear.
himself.
So this is okay, very clear. So this is how you start the station. You take the complaint, okay. You ask about the symptoms of schizophrenia, if there any other persecution, and if there are auditory hallucinations. You ask about the social information, the medical, and the risk. In short, you gather the biopsychosocial information, psychological, social, medical, and risk. And then you explain to him what is the problem, and then you formulate. And again, I'm not going to go through the details of formulation. Please watch the video, the explanation of the formulation, okay? You explain to him that he is suffering from a relapse because of stopping his medications and taking cannabis. in order doctors to make sure that when you talk about the management, because you will start talking about the management in the last 90 seconds. So you must make sure that you are very well organized in order to cover as much as possible the important points in the management. The first thing, as I always say, start by saying, what are you going to do and where the patient is going to be treated, okay? Dr. Demiana, you should follow him up more regularly in the clinic, assess his mental, physical states, and do risk assessment and address his concern. So this is how you start talking about the management. Then the investigations, the routine blood tests, we know the liver function, etc. But sometimes we need to add other investigations. Here, the patient is having, this erectile dysfunction. So there can be high blood sugar level or prolactin. Must mention them to show that you know that there are other causes than the stopping the medication, other than the medication itself. Okay. Now the medications, how are you going to help the patient? Please mention that there will be a team who will cover all his needs physically, psychologically, and socially to show to the examiner that you are a doctor who is keen to have this holistic approach, this personification of your approach, not only a disorder-minded doctor. So you start by the medication, give him a chance to choose between olanzapine again or aripiprazole, okay? Don't be authoritative. Mention the talking therapy to challenge his delusions, okay? And socially talk about the alcohol and substance misuse team. Other than this, there is nothing. The passing rate in this station also is low. Here it is. This is how practice it. The management stations are difficult. As you can see, it needs time management. A lot of things you need to do. Let's see the mark sheet. This will be the last time I'll go through the mark sheet. The mark sheet here, the formulation, please, doctors. As you can see, this is the first point to be scored for you, and the mark sheet. This is the mark sheet in the hands of the examiner. If you do not formulate yours properly, it will be not a good thing that the first point in the mark sheet will be crossed, not in your favor, okay? You recognize, Dr. Demiana recognized the significance of findings and result. Adequate management plan. I don't know why didn't you talk about the olanzapine, the aripiprazole. This point might or might not be scored for you. You did discuss with me the options of the medication. So point 4, as you can see, those who are keen to say that I'm going to talk with the patient myself and discuss with their patients the different options. The point number 4 is going to be scored for them. Because Dr. Demiana discussed the risk issues, so point 5 is going to be scored. She mentioned the social interventions, but she didn't mention the CBT, so this point might or might not be scored for you. As for the communication, the only thing which might not be scored for you, the poor management of the consultation because of the time management. Other than this, everything is okay. Okay, I hope that you found it helpful. But very clever, mashallah. Let's see the doctors who is Dr. Aini. So what is your question, doctor?
Hi, Dr. Assam. Thank you for the wonderful session. Just two things I wanted to ask. One, you have almost already covered. So when Dr. Demiana started, like what has been happening, at the same time, can we ask, like he said, since 2 weeks he has been having delusional beliefs. So can we ask at the same time, was there anything specific happened around that time, or were you taking some street drugs or alcohol? So
yes,
that might
we
cover.
did. When you are
And
organized in
yeah.
taking your complaint and you ask about what happened during the onset and how was he doing before the onset, definitely you are going to ask this question. These are the predisposing precipitating factors which I've just mentioned. Okay,
Yeah.
thank you so
And
much.
other thing is it worth asking about any kind of thought disorder? I mean, the other first rank symptom or just
Don't
hallucination?
waste. No, doctor. He is already diagnosed with schizophrenia.
Okay.
We just want
Oh,
to establish that this patient is in relapse. That's it.
okay,
Don't go
okay.
through details of first rank
Yeah.
Schneiderian. It will be a waste of time. And as you can see, there are a lot of points to be covered here.
Okay, okay. That's what my question was. Thank you so much,
Okay, and
doctors.
yes, and after all, as our colleague said, it is a management station. Okay, so not a history taking. Dr. Al-Fiqi, Dr. Ayman. So, how are you, doctor? So, what is your station, Dr. Ayman?
عبد الأعلى الفقي. Okay.
عبد الأعلى ولا دكتور أيمن؟
الفقي عبد الأعلى الفقي.
Sorry.
First name عبد الأعلى.
Yes, عبد الأعلى. So, what is your station, doctor?
Postpartum psychosis.
Postpartum psychosis. The stations of pregnancy are also okay. I'm ready whenever you are ready.
Okay, could you tell me the name, or shall I ask in the station?
Yes. Let's say that my name is Mr. White and my wife is Mrs. White. Okay, 1, 2, 3. 1, 2. Ready, doctor? Okay.
Yes, Dr. Vadi.
1, 2, 3, go.
Good afternoon, Mr. White. I'm Dr. Al-Fika, psychiatrist from the mental health unit.
Hello, doctor.
Hello. My understanding that your wife has passing through difficult time and she has some psychiatric symptoms. And I'm here to talk with you about how we can support her. But first of all, I would like to hear from you what's your understanding about her condition.
Well, doctor, she has changed, and I'm very worried about her. She's talking that the child is having leukemia, and she's mentioning things which are totally out of the mind, doctor. And I'm very worried about her, doctor. What's going on?
I see.
She's talking about the devil and things which are, and she's very emotional. So what's going on?
Yeah, I see, and I'm wondering if she has ever been to psychiatrist before.
No, this is the first time for her to be in contact with psychiatrist services.
Okay, thank you for sharing this, Mr. White. I would like to tell that your wife has a condition called postpartum psychosis. And this condition is quite rare. It's about 1,000 in 1,000 births. The mother after delivery might develop thoughts which is false, but fixed for her, and it's unlogic, like the thoughts that her child will be harmed by the devil. And also she might hear voices with no one around. This condition is called postpartum psychosis. And I would like to...
Yes.
Okay, sorry.
Okay, continue, doctor.
I would like to ask you some questions related to her support right now. With whom do you live? This is the first child for her. Am I right?
Yes, yes.
So from where should she receive her support?
Well, her mother comes to be with her, to stay with her nowadays.
Yeah. Okay. And what did she make to protect her child?
She wants to go and do blood tests for him because she believes that he has leukemia, and she says that the devil wants to take him from her, and she's very tearful, and she talks about a lot of nonsense, doctor, but I'm really worried. What could be the reason for this postpartum psychosis?
Yeah. I understand your worries, and it must be a stressful time for both of you. And the cause is multifactorial. Multifactorial. It's not only one factor, but the genetic role plays a role here, and maybe the stress also. So I'm wondering if there is anyone in her family has any psychiatric illness.
No, no.
Okay. So as I mentioned, it has a genetic role, and the stress after pregnancy, also the changes in her biological condition after pregnancy, make her prone to develop this condition.
Doctor, so any risk from her, any risk from this disorder, doctor?
I'm afraid to tell this. There is a risk for her, and there is a risk for her child. So I'm asking if there is any, if she expressed any thoughts that she might harm herself.
No, no.
Or protect her child by any method or any mean.
No, no.
Okay. So again, there is a risk because she doesn't know that she has an illness, and she is totally convinced about her ideas. So there is a risk for her and a risk for her child also.
What is the difference between postpartum psychosis and postpartum blues?
Okay, postpartum blues, this happens more common than postpartum psychosis. And it's not a severe condition like postpartum psychosis. The postpartum blues, maybe the woman is in low mood, and this will maybe improve without intervention or admission to psychiatric health unit. But
Okay,
here, the condition is more severe.
Okay, doctor, so how can we help her, doctor?
Yeah, thank you for this. Thank you for your support. It will play a great role in her condition. First of all, we have to rule out any cause or organic cause for her illness. So we will run some investigation to rule out any organicity.
Yes.
Work in a multidisciplinary team and biosocial. So the biological part is first of all where to treat her.
1 minute remaining.
I will offer to be admitted in a psychiatric health unit because she has a risk to her baby and risk to herself. And if she refused, we might use the mental health legislation. And we will offer some medication, antipsychotic medication, to treat her condition.
I see that.
The other parts of management would be psychological and social. So the support and to work through to do for her family or marital counseling, or to make a supportive therapy for her. Also, psychological part, maybe we will liaise with the health visitor and community psychiatric nurse after her discharge. And right now we will separate her from her baby until we sure that she is recovering well for her risk.
Time. How do you feel about what you did?
Okay, the answering management questions, it was late at the station, and I have a lot to say about management questions. Also, the last point, it should be admitted in a mother and baby unit, but if there is a risk on the baby, we will follow and review.
Doctor, it's your management is over. Give me a feedback about you. How did you feel in this station? The station is over, brother. So give me a feedback.
The last word in the management, I rushed into the last word. It might be wrong. I couldn't find time to tell my management. Then maybe because I delayed, I cut, you started to speak, and every time I take the hand from you, and this was wrong, I didn't make the station open. It might help me if I did it.
Okay, very clear. So pay attention to the forum. Always chunk and check, because I felt that you are lecturing. You are not keen to make sure did what I don't remember that you mentioned once. Did you understand what I'm saying? Are you following me? Did what I said make sense? I felt that you are lecturing. Okay. Avoid using Arabic words. You remind me by myself the first time I started preparing for the task. In the middle of the conversation, I just uttered some Arabic words. You mentioned kalimat aw, which is mean otherwise or.
This is
okay, pay attention. They are very, very attentive to this. If you mention one word which is not English, definitely this will not be in your favor. You mentioned a lot of jargon, doctor. Pay attention to the jargon. I don't know what is your source, but as far as I know, most of the sources avoid the jargon. You must talk about the mother and baby unit. The very first thing, this lady should be admitted in the mother and baby unit. Okay, in the mother and baby unit, the relation, they don't separate, but the relation is supervised. Okay, so we don't say yes, there can be separation, but eventually it is a supervised relation. She can be in contact with her child, but under supervision to make sure that she will not hurt him. Okay, so with all respect, the issue here in your communication is that your English language might not be very supportive. And this is not a big issue, by the way. Just make sure that you write down the sentences which you are going to use in this station and in every station. And the good thing that with time, you'll find that you are using the same sentences. You are repeating the sentences which you are going to use. So if you did a script for this station, you'll find that the sentences which you are going to use in this station are very close, or you are repeating them in other stations. Because I felt that you were struggling to formulate the sentences, and this consumed time, and sometimes the sentences were not actually accurate linguistically. Okay, pay attention to this. Or you can have a source which can help you. You can either do this, but I prefer that you will do your own notes, because this will help your linguistic skills. So either you can have a source and you just know it by heart, and you'll find that the sentences are repeated. And in my PDF, I tried to repeat the same sentences and the same dialogue in order to make sure that the candidates will not find it difficult to follow up what's going on in the PDF. But if you don't want to buy it, no problem. But make sure that you improve your language. Otherwise, you'll not pass the station. Okay, let's see.
Sorry, doctor.
What?
How can I get it?
Okay, you can just discuss with me later on. But as I said, the best thing is to have your own notes if you want to discuss this with me later on. Okay, so let's see this station, how we can tackle it according to the PDF. Postpartum psychosis. Bismillah. So I want you all to pay attention to the script which is written to the role player. So they ask him to show that he is concerned and worried, and so why these two They want to challenge your communication skills. So you want to see who are the candidates who are paying attention to these emotional attitudes, and they have their good communication skills and have this appropriate interaction with the role player. Every word written in the scenario is very important. And as you can see in every station, they are instructing the role player to have a particular attitude to challenge your communication skills. And by the way, you paid the appropriate reciprocal emotional interaction and you showed empathy. But pay attention to this, pay attention to the scenarios written. Sometimes the candidates are not keen to read the role player notes. Please don't do this. Okay. Now the management plan. First thing, doctor, okay, you don't have enough information, so you want to know more information in order to address his concerns. So I would like to know more about the condition of Mrs. X in order to address all of your concerns. The things which you want to know are not much, but very important. You want to know the social circumstances and the risk. Okay, eventually you ask about the risk in the middle of the station. But this is something which you should ask in the very, very first beginning. You want to know the social circumstances and if there are any stresses, the support, and the level of risk. Then you explain the problem, which is very good. What could be the result of the cause of this disorder? Again, pay attention to this. The first pregnancy, there are factors which make this disorder more common. Like what? Like being the first pregnancy, complicated pregnancy, very young or very old pregnancy, sleep deprivation, and hormonal and chemical imbalance. And unfortunately, I did not answer this question properly. Okay. What is the difference between postpartum psychosis and postpartum blues? Again, this is a common question. Postpartum blues is a common disorder, happens in 50% of the ladies who after delivery, and it usually happens within 5 days after delivery. Okay, as you can see, 5 and 5, 50% and 5 days, and resolve within 2 weeks without any intervention. And mostly emotional lability and sleep difficulty and anxiety. Then now I want you to formulate for me, what is your form? How will you formulate this station?
Your wife has an illness called...
No, just say Miss, don't say your wife, Miss X, okay? Miss X, Mr. Brown.
Miss White, yes. Miss White, diagnosed with a condition called postpartum psychosis, should be treated inside the hospital psychiatric ward.
No, this is the management. Now, as you can see, doctor, you are establishing a common mistake. The candidates do not understand what is the formulation. Formulation is not the management. Formulation, you are just crystallizing what is the problem. You are just summarizing filtering all the important information from all the discussion which we have done. This is the formulation, okay? We are not going to talk about the management of the formulation. You want to know what is the problem. The main psychological problem here is the postpartum psychosis and the level of risk. So this is the first line. She is suffering from postpartum psychosis and carries risk. There is risk on her and the baby from her mental state. And then the second line is the background. Okay, what is the background? All the information which you know or you need to know in her psychosocial domains. All this on the background, having no past history of mental health problem, there are no stressors, and she is having enough support, and there is no physical problem. How do we know this information? Because in the beginning, we asked about the biopsychosocial information. As you can see, there is a particular sequence in order to make sure that we will cover everything in our dialogue with the role players. Okay, so in the management, the first thing what Dr. Fiki is going to do, okay, and where the patient is going to be treated. As I always say, show that you are assertive doctor. You are going to talk with the patient going to explain to your patient her problem and the management plan and address all her concerns. And because of the safety concerns, she is going to stay in the mother and baby unit until it is safe for her to go back home. Okay, so this is how you start talking about your management plan. What are you going to do and where the patient is going to be treated? And because there could be a use for medications, you are going to do for her the blood test, and you must mention what are the blood tests which you want to do. Okay? And then talk about the team who will cover all her needs physically, psychologically, and socially. Okay? And the medications, you are going to give her a medication which is suitable for the breastfeeding, like olanzapine. Psychologically, there can be talking therapy, and socially, doctor, don't forget, because it is about the risk. So you must talk about the social. What are you going to do in order to make sure that this patient is going to be safe on herself and the others? So you must plan for the discharge. When the mental state is stable and it is safe for her to be discharged, okay, she will go back home and she will be followed by a nurse. Okay? This is how you are going to talk about this, the postpartum psychosis. Again, I'm not going to go through the management, the mark sheet, but again, you must refresh your memory about the disorders by these visual educational diagrams. Don't go through the textbooks. Okay. I hope that you found it helpful, doctor. Okay, very clear. Thank you so much. Okay, who would like to go next?
Can I go next?
Yes. So what is your station? Well, Dr. Joyce?
Yeah, it's post. Sorry, I want to put on my camera.
What is your station?
It's postpartum. Sorry, post MI depression.
Post MI depression.
Yeah. Sorry.
Okay, so we're going to talk to a student nurse. Pay attention.
Okay.
You ready?
No, just a minute. Okay.
Okay.
Sorry, how do I address her?
Let's say that my name is Peter. 1, 2, 3, go.
Yeah. Hello, Peter.
Hello, doctor.
I'm Dr. Sagale from the mental health team.
Hello, doctor.
Yeah, I understand that you've got some concern that you would like for us to discuss.
Yeah. There is this Mr. Brown. He has been referred by the GP, and I read in the notes that he is having a myocardial infarction. myocardial infarction, but he's not engaged in his rehabilitation program.
Yeah.
And he also has low mood, and he's missing his scheduled, sessions. I would like to know more about his problem, and how can we help him?
Yeah, thank you, Peter, for sharing what you know about Mr. Brown with me. Just like you rightly said, Mr. Brown has got low mood, which is why he was referred by the GP. He also has other features which are suggestive of depression. And saying that he's recently been admitted in the cardiac ward and was managed for a cardiac attack, which is the myocardial infarction. We do think that he has what we refer to as post-myocardial depression. Is that something you're familiar with?
No, what is this?
Also, when people have developed depressive symptoms, like Mr. Brown has developed following a heart attack, we do say that they have post-myocardial depression. So some of the symptoms you might find in them will be low mood, decrease in energy, as well as loss of interest in activities they previously enjoy. Are you with
Okay.
me, Peter?
Yeah, yes, doctor. So could there be any other reason for his low mood?
Well, yeah, it could also be possible that he may have a depression that's not associated, or he could also have some other social factors that may be contributing to why he's feeling low.
I see. How can the myocardial infarction cause depression?
Well, Peter, it's been shown from some studies that about 1 to 5 people who have a myocardial infarction would tend to develop depression. Are you with me?
Yeah, yeah. So how can depression cause myocardial infarction?
Well, it's by that it could cause myocardial infarction, and the myocardial infarction could also lead to someone becoming depressed.
So, doctor, how we can help him?
Well, looking at how Mr. Brown has presented, currently he does have low mood with the background of having a heart attack. And although he's been enrolled into the cardiac rehabilitation program, I could see from his notes that he's just attended 2 sessions and has not been able to go. And this would worsen the outcome for Peter. So in terms of managing him, for Mr. Brown, sorry about that. In terms of managing him, Peter, I think it would be best if we use the biopsychosocial approach. By this, I mean looking at medications. Is it okay
I
to go
see.
on?
Yeah, yeah. Okay, go on.
Yeah, so we would be looking at medications for to commence him on. And in Mr. Brown's case, I will be working with my other colleagues who are members of the team just to see how best we can help Mr. Brown. So in terms of the medication, I would like to commence him on sertraline because there are trials that have shown that sertraline is the safest antidepressant we could use, saying that he's had a heart attack.
Okay. Okay,
Yeah.
that's good.
Yeah, have you got any questions?
No, no, no. You can proceed.
All right. So in terms of the other management that Mr. Brown would benefit from, I would be looking at referring him to the therapist, a trained therapist who would have a talking therapy with him, which we refer to as the cognitive behavioral therapy. Have you heard about that before?
No, what is this CBT?
Yeah, so
This
in
guy's
CBT,
boring.
yeah, in CBT, he would be having a talking therapy with a trained therapist. And what it just does is it looks at how his thoughts would be affecting his feelings and how this in turn would affect his behavior. So the therapist would just try to look at some of the factors that may be preventing Mr. Brown from going for the rehabilitation program, as well as other stressors he may have.
Okay.
Is that okay? Yeah.
Yes.
Apart from the talking therapist, I would like to also work with the cardiologist, saying that he's
Yes.
had the cardiac attack, just to see to ensure that he would be able to monitor his heart medicines as well.
I see. I see, though.
Yeah. And then the other thing we could do for Mr. Brown Peter would be to involve the dietitian who would help with his diet and also exercises.
1 minute remaining.
Yeah. Are you with me, Peter?
Yeah.
And then looking at the fact that Mr. Brown has suffered this cardiac attack and he's had some recent stressors in his life, I would also like to involve the occupational therapist just to see he might be needing some modifications in terms of maybe his job.
I see.
Yeah. Have you got any questions for me, Peter?
No, no. Thank you.
All right. Yeah, so just to summarize, we've talked about how we would be helping Mr. Brown in terms of his medications, having a talking therapy, as well as involving the dietitian and the cardiologist. Thank you.
Okay, Dr. So how do you feel about what you did?
Well, I
Okay,
felt
now, look, Doctor.
okay.
Just
Well, I think that one of the things that got me thrown off was in the station. They just talked about, I had talked about him before. They talked about the recent stressors, and those were not things that, apart from the the myocardial infarction he had, those were not things that were really elaborated. So I didn't know whether the student nurse would have that information or whether I should ask more, like if I was talking to a relative.
okay. Okay, so very clever anyway. So pay attention to this station, which I don't need to say that also the passing rate is not very good. So in this station, there can be some different scenarios.
Okay.
Either this scenario or there can be another scenario here in which there is some more information you get about him, that he is 53 years old teacher with a demanding job, 8 months duration of heart pain and heart attack 3 weeks ago. He has depressive symptoms of 7 months of duration for which he has been referred to the local health services. So there are different scenarios. You just make sure it is ready, have a look at it and pay attention to the questions which are posed to you and the answers here. I hope that you take screenshots. If you don't
Yeah, I will.
please pay attention because the information here, as far as I know, is not anywhere else. So how you are going to tackle this station? You explained in the beginning that she has post-MI and so far, but you must give some information that it can go unrecognized in 10% of the patients. Okay. Why is that? Because of atypical symptoms.
All right.
That's it. Don't say more than this. Just say atypical symptoms. So though it is 20%, but 10% of them are only diagnosed out of the 20%. Only 10% are diagnosed because of the atypical symptoms, okay? Could be there any reason, which is the question about the differential diagnoses. This is a question about the possible differential diagnoses. So what could be the other possible differential diagnoses? That he is having an adjustment disorder, or he is having another relapse of his depression. However, because of the close temporal relation and the high prevalence, most probably it is post-MI depression. Okay, Dr. Joyce.
Yeah.
This is the first question which you need to pay attention because your answer was not the best answer. Okay? So can MI, the myocardial infarction, cause depression? Yes, the cause is not clear. However, there are some possible reasons. What are the reasons which make the patient who have myocardial infarction has depression? Okay, these are the answers of someone who is proposing himself as a member of the Royal College. The stress causes an increase in cortisol hormone, and there are inflammatory chemicals which increase the chance of having depression. In addition, there are some contributing psychological factors like existential crisis, feeling helpless and hopeless and unable to enjoy the life as before. So we have psychological and biological changes after the myocardial infarction, which make the patient more prone to have depression. So you have now first question regarding the prognosis, which the candidates have problem in the, differential diagnosis with the candidates have problem to answer. And now can the myocardial infarction cause depression? This is another question which the candidates have a problem in how to answer. And the third question, can depression cause myocardial infarction? So the patients who have depression, no past history of myocardial infarction, are they more prone to develop depression? This is a question which you're going to get. Okay, yes. Why is that? Heart problems are common among patients who have depression. Why is that? Some of the contributing factors are associated with sympathoadrenal hyperactivity, and you can mention these medical jargons because you are talking with a medical colleague. Sympathoadrenal hyperactivity, the platelets activation, inflammatory proteins, and myocardial ischemia in reaction to stress. So all these are factors which happen in a patient who have depression, these factors make them more prone to develop myocardial infarction. Okay, doctors, clear with me?
Yeah.
So these are the three difficult questions in this station. Could be there any other reason for this low mood? The differential diagnosis. How myocardial infarction causes depression? Can depression cause myocardial infarction? And then how we can help him, the formulation. I'm not going to go through the formulation. You can see how you can formulate this station according to the explanation in the YouTube channel about the formulation. So let's see how we are going to talk about the management. Okay. So first thing, Dr. Joyce, you must show that you are an assertive doctor. I would like to talk with Mr. Brown myself and see him more frequently in the clinic to assess his physical and mental states and do the risk assessment. In addition, I would like to explain the diagnosis and address his concerns and pay attention. What could be the possible reasons for the non-engagement in the rehabilitation program? Okay. What could be the possible reasons? It's not only maybe he has other reasons. Show that you are a patient doctor who is keen to understand his patient. Okay. So this is what you are going to do. Ideally, where the patient is going to be treated, he should be followed at home. However, if there is high risk, the admission to the hospital might be considered. So this is how you start talking about your management. What are you going to do, Dr. Joyce? Am I spelling your name right, Dr. Joyce? Okay.
Yes, Joyce.
Okay, and don't forget that you must understand what could be the reason, the possible reasons behind the non-engagement. Okay? Okay. And pay attention to the following, the investigations. Now you are talking about a patient who has a comorbid medical condition, and you are going to use SSRIs. And definitely you are a clever doctor to understand that our medications affect the clotting profile. So you must do a coagulation and INR tests as well. Okay, so you are going to do the routine tests. You're going to double check them. And also very important to mention that you are going to do this coagulation and INR tests because our medications affect them. And by the way, there has been a very famous station about the patients who has been taking heparin, and you used with, you gave him, this is a station which didn't used to come. But the trick in this station that you should have assessed the coagulation profile and the INR because you added an SSRI to the patient who is taking heparin. And now you have a patient who had a recent myocardial infarction, and definitely his clotting profile should be under control, very close control. Okay.
Yeah.
Lot of information, lot of tricks, doctors, in the management plan, and this is from the discussion with a lot of the candidates and lot of all the questions which they get and feedback which they get. So pay attention to this information which I am giving you. So don't forget, while you are managing a patient who have heart problem, that you must talk about the coagulation and the INR test. Okay.
Okay.
Now you must talk about the team who will cover all his needs physically, psychologically, and socially. Very important to talk about the physical part, because you must liaise with the physician and GP to discuss with them the condition of Mr. Brown and the medications which he's going to use. Psychologically, he will benefit from, as you said, the SSRIs, and definitely you know that the SSRI affect the clotting profile. Okay, and in this context, you must talk about the medications which you should avoid. And he is going to, the role player is going to ask you about what are the best medications, what are the medications to avoid. And as you can see, you must say that it's better to avoid tricyclic antidepressants and venlafaxine. Okay. And within the psychological lines of treatment, talk about the CBT, which is very helpful in the patients who have a depression, post-myocardial infarction depression. Okay. Pay attention to the following, doctor, the social part of the management. So we talked about the physical, the psychological. Now we are going to talk about the social. Yes, the social services, because the social services must communicate with his work to make sure that the treatment duration will not affect his job. Okay?
Okay.
With me? And you have also the occupational therapist, which will make sure that his work is suitable for his mental and physical circumstances. Now, this man is now handicapped. He is handicapped. He has heart problem. He definitely in his workplace, we must consider this. Okay. Regarding his healthy lifestyle, he must discuss this. He will follow with a dietitian, joining subsidized gym under the supervision of physiotherapist. Okay. And if he has problems with cigarette smoking and alcohol or recreational drugs, he can book an appointment with alcohol and substance misuse service. This is how you talk about the management of a patient who has a post-MI depression as a member of the Royal College, okay?
All right,
The
thank you.
information which you have in your notes, I know they are very, very defective, very superficial, okay? I hope that here the notes in front of you, if you don't want to buy it, this station, the passing rate is horrible because they don't pay attention to this information. And also they don't know how to answer the questions here. How can the myocardial infarction cause depression? How can depression cause myocardial infarction? What could be the other reasons for this low mood? All these are questions which the candidates don't know how to answer, and you don't have the right answers in the notes which you have here. You have it for free. Okay, thank you so much, Doctor.
Thank you. Thank you.
Now I just want to go and have just to pray. Give me 10 minutes and I will come back. Thank you.
Okay.
Hi, doctor. I'm back again. Okay.
I would like to go next.
So who would like to go next?
I would like to go next. Hello, can you hear me?
Okay, doctors, so someone who's saying existential crisis. Come on, man. No, it is not that difficult. Okay, so Dr. Ejio, can you tell me?
Yes,
Adioke.
yes, 36 weeks pregnant,
So what is your station, doctor?
The woman that's 36 weeks pregnant with 2 previous episodes of psychosis.
The voice is not clear, please. So yeah, I don't
Hello,
know the
can you hear me now? Hello?
yes.
Okay.
So this is the station, okay. Ready?
Yes.
1, 2,
What's
3.
your name? What's your name?
Let's say my name is Mrs. Green.
Okay.
1, 2, 3, go.
Hello, Mrs. Green.
Hello, doctor.
My name is Dr. Abiodun. I'm one of the doctors in the mental health unit. I understand you have some concerns that you'd like to discuss with me.
Yeah, doctor. I'm worried, doctor, that you know, I'm now pregnant, and I have a history of 2 attacks of, psychosis after my previous pregnancy. And I want to know, I'm 36 weeks pregnant, and I'm afraid that I might get these attacks again.
Okay. You said you were pregnant. Was it a planned pregnancy?
Yes.
Oh, congratulations. Um, you you express your concerns that you're afraid that you may have another episode. So I'll have a discussion with you to address your concerns. In order to be able to know how to support you more, I want to ask some questions if that's all right by you.
Okay, no problem.
So how has your mental health been in the last 12 months? Because I understand
Very good, doctor. I've been very good, and that's why I decided to have another baby. I feel in the past 2 years I was doing so good.
Oh, that's good to hear. Just to check with you, is there any unusual experience in these few weeks?
No.
All right. So during your previous episode, during your last delivery, what were some of the symptoms you presented with them?
Well, I had a horrible mental problem. I don't remember anything, but I had to be admitted twice, doctor. I had 2 babies, and after the delivery, I had to be admitted for several weeks.
That must be quite distressing for you at the time. Well, it's a good thing that you're doing so well now, and your worries are justified. If I may ask, do you have any support at home currently?
No. Yes, my husband is very supportive.
Okay. Apart from your husband, is there any other support you have? Maybe your siblings or any other family members?
No.
Okay. I'm just wondering, do you have any physical health concerns?
No.
Okay. For a while now, you've been well. Has there been any time with this worry about recurrence that you've thought of maybe putting yourself in any way?
What?
I said with the worry going on in your mind, Has there been any time you felt overwhelmed that you felt you could end your life in any way?
No.
Or thinking about hurting your children or your baby?
No.
Okay, thank you so much for saying all this. You know, at times when people are worried, they could cope with recreational drugs. Are you using any recreational drugs?
No.
Okay, so just to check with you, do you have any family history of mental illness?
No.
Okay, so from what we've discussed so far, I could see that you're 36 weeks pregnant and you've had 2 previous episodes of illness in around the time you had a baby, which we refer to as pueperal psychosis, and you have been treated in the past and you've been able to be well on partum and lithium. But right now you're worried, you don't want to have a recurrence, there's no family history, no health issues. So
Yes.
considering all this, I want to think of what, like you asked earlier, address your concerns about if you're going to have a recurrence or not.
What are the medications which you advise me to take?
All right, so thank you for that question. Considering the fact that you've used partum and lithium before in the past, and those medications got you well, we may want to consider you going back to the medications, especially the partum, depending on what your views are, or what are your views about them.
Are these safe in pregnancy? I've read that lithium is not safe in pregnancy.
Okay, so for lithium, in pregnancy generally, especially in the first 12 weeks of pregnancy, it will result in a bad defect that could affect the heart. But considering the fact that you are 36 weeks pregnant now, the risk of that is low. So it's something we may still want to consider together with the partum that you used before.
What is the effect of lithium on the baby, doctor?
All right, so for pregnancy, during the early part of pregnancy, it could cause a bad effect called Epstein anomaly, which is like a form of bad effect that affects the heart during the time that the organ of the baby is forming. So that time has already passed. But now, if we commence the lithium now, you may need to be monitored regularly because there may be some form of floppiness in the baby after birth. But not to worry, we will involve some other teams like neonatologists who will monitor the baby to ensure that the baby is doing well.
I see, doctor. So, well, doctor, so what are you going to do to help me then?
All right, so what we are going to do is to have a form of management
1 minute remaining,
where we involve your safety planning. So in terms of the medication, like we discussed earlier, we could start, commence your medication for partum or lithium, depending on the one you're comfortable with. Preferably, we advise for you to commence it to prevent relapse. So in terms of the psychological aspect, we want to psychoeducate your family members so that they know how to support you when you give birth to your baby, so that you can have time to rest, to be able to prevent relapse. Are you with me so far?
Yes.
All right, so in terms of the social aspect, you have family that is supporting your husband. We want to encourage him to support you. Then there will be a community health nurse that will support you. Then we plan the delivery to ensure that you and the baby is monitored, because if you're on lithium, we need to adjust the dose according to the level in your blood.
What will happen again if I became unwell again after the delivery?
All right, thank you. So if you become unwell, we need to assess you urgently. So those symptoms we notice early, you need to let us know. I'm going to give you a phone number that you could call so that you can be assessed on time. If there is no risk to yourself and your baby, the crisis team will see you at home. But if there's risk to you and your baby, you may need to come back for admission in a mother and baby unit where you'll be monitored properly.
What will happen if I go into labor before my cesarean section?
All right, so if you go into labor before your cesarean section, the obstetrician will attend to you, but not to worry, they will get in touch with the mental health team so that we can be aware to be able to support you well.
Okay, time.
Thank you so much for talking. How do you feel
about what you did?
I think initially I was able to cover some things. But towards the end, I think I'm rushing because I feel time is already going.
I see. So let's see this station also, which is challenging. And I have to be honest with you, I found it very difficult to follow up the conversation with you because there has been some disruption in the voice. I don't know if I'm the only one who had this voice problem while I'm hearing you.
Maybe the network.
Okay. Bismillah. Okay, give her your feedback, please, doctors. Okay, so how would you start the station? This is our plan, introduction, gathering the biopsychosocial and risk. So as you must have a plan, as I always say, and the plan is in this blue box. These are the 5 points which you are going to cover in the 7 minutes. In the very first beginning, I tried to show to you that I'm distressed, but you did not show very good empathy. Okay, pay attention to your communication skills. The first thing you want to know is the basic information which will help you to set the appropriate or the right management plan. So you want to know the psychological, the medical, the social, and the risk level of risk without taking history as if it is a history station. Just tell me to ask her about the circumstances of the previous admissions and whether any concerns about her safety, about her medical condition, the social circumstances, and the level of risk if there is any, like using recreation drugs, etc. Now you must explain to her her problem. So you must mention that the risk of relapse is up to 80%, particularly if there are more than one attack. Okay. As for the and you must explain that. As for the medications, this is when you explain. You are not going to explain only the problem, the medical problem or the psychological problem. You must also put in your consideration that you must talk about the medications. You must mention that after 36 weeks, most probably giving her the medications, this will not affect the development of the baby. What are the medications? You must mention that the best medications for her are the medications, you must articulate it, are the medications which helped her before. Ideally, she should take lithium and quetiapine. Okay. What are the effects of lithium on the baby? Okay, you must talk about the Bechstein anomaly, and which is increased about 10 to 20 times. And 1 in 10 of the babies whose mothers are taking lithium will have malformation. The lithium increase all the type of malformation by 3 times, and the risk of heart malformation by 8 times. As for the quetiapine, it is safe in pregnancy. Okay, this is the conventional and the classic answer. So some of our colleagues say that there are new information that lithium is much safer. We are not here in an academic debate. Please, doctors, give the right consultation. Okay, this is what you are going to do in your real clinic. When someone asks you about the lithium, mention these side effects. Can I breastfeed the child? This is a very common question. Lithium is secreted in milk, and it is advisable not to feed the baby, breastfeed the baby. You forgot to do your formulation. Please go through the formulation explanation. Now, regarding the management, you must be organized, doctors, when you talk about the management, because most probably you will start talking about the management in the last 90 seconds. So the first thing, what you are going to do and where the patient is going to be treated. So this patient should be closely followed up, and you must follow her up, and there will be a nurse. And if there are any safety concerns, she might be need for admission. Okay. Where the patient is going to be treated, she's going to be, ideally speaking, she's going to be treated at home. However, if there are any safety concerns, she might be admitted in the hospital. Then number 2, the investigations. We have our routine investigations. Number 3, with the patient. What are the technical steps now? There will be a perinatal team. You must talk about that. You are going to liaise with the physician, with the obstetrician. This is the physical part. Now the psychological part, we mentioned the quetiapine and lithium. Okay, and you must mention that before the delivery, lithium will be stopped and the plasma levels will be checked after the last dose by 12 hours, and the dose will be adjusted accordingly, okay? Now, the questions which I asked you, these are the typical questions, doctor, which you are going to get in the real stations. What will happen if I became unwell again after the delivery? Rest assured that this probability is planned for. You will be closely followed up by the perinatal team for the early detection of the signs of relapse. And the team will intervene immediately to control the symptoms. However, if the risk is high, the admission to the hospital can be considered, okay? So this is the first question which you are going to get in this station. The next question, what will happen if I go to labor before my cesarean section date? Also, this is a very common question. You will have contact numbers for the emergencies and the crisis team. Okay, doctor? Please inform the obstetrician about your mental health needs, the medications, and the need to stay in a mother and baby unit, and the need to contact your perinatal team. So if she has the labor symptoms before the time, okay, she has these numbers for the emergencies, and she must inform the obstetrician about her mental health needs, the medications, and the need to stay in a mother and baby unit, and also to contact the perinatal team. This is a very common question in this station, okay? Okay, so
Thank you so
I
much.
hope that you found it helpful.
Yes, thank you so much.
As you can see, doctor, the management stations are not easy. It needs a lot. Okay, you must just work on these stations more than the other stations. So who would like to go next? Hello, who would like to go next? We have postpartum depression. Who is supposed to do the postpartum depression? Anyone would like to?
Yeah, Dr. Hussam, yeah.
Dr. Nasser, are you going to do this station?
Okay.
Okay. Okay. Ready?
Yeah, ready.
Okay. One, two, three, four.
Good evening, Mr. White. I'm Dr. Gabriel, one of mental health doctor in the clinic.
Hello, doctor. I'm very worried about my wife's condition, doctor. What's wrong with her, doctor?
I can see that you are worried about your wife condition. I happy to discuss with you how we can help her. But also, could you tell me first what is your understanding about her condition?
Well, she has changed, doctor. I don't know what's going on. She's talking that my son might have leukemia, and she's not taking care of him. Okay, and she believes that she's a bad mother and she is hopeless, and she feels that she is not able to change what is happening to her child. She has changed, doctor. What's wrong with her?
It must be very difficult for you. I see your wife and I discussed with Mrs. White about her condition, and we found that she's suffering, experiencing low mood, as you said, and a little bit worried about her baby that he has leukemia and unable to take care for her baby. And we diagnosed with a condition called postpartum depression.
What is this
Have you?
postpartum depression?
It means that when someone goes through a stressful situation, experience low mood, unable to take care for himself, didn't enjoy things that used to enjoy, like your wife, little bit worried about her baby, thinking that he has a bad mother, and all of this, if happened during or after pregnancy, we diagnose it as a postpartum depression.
I'm not
Am I
married
clear?
to a man. Why do you say that my wife is he?
Could you tell me what it was?
So what is the cause of the postpartum depression?
We didn't know the actual cause, but there is a lot of factors that can lead to someone suffer from postpartum depression. One of these factors is stress of pregnancy itself. And I understand that he also has a family history of low mood, and he had experience like these symptoms in the past. And sometimes some disturbance of some chemicals in the brain. And sometimes we didn't know the actual cause.
Okay, so there is any risk on the baby because of this disorder?
I understand that she's a little bit worried and thinking that he has bad mother. Are you worried about her bonding with her baby?
She is not taking care of the baby properly.
Yeah, it is quite concerning. So she is unable to take for her baby. So we are going to manage her in a mother and baby unit. We would like to discuss with her about this management plan.
Is she going to get better?
Most of people with the good support and the good management plan, good medication and psychological support, social support, and the family support like you will get better outcome.
So how can you help her?
I can see that you are worried about her. We have a lot of options to help her. We working in a multidisciplinary team where a perinatal psychiatrist and a nurse and a psychologist and occupational therapist and midwife and obstetrician all together. We are working together to get the best care for her. Am I clear so far?
Yeah, very clear.
So we can offer him medication that can help her in her low mood to be more better in her mood, to enjoy her life and better care for her baby.
Okay.
And also we can offer care in mother and baby unit where is a psychiatric nurse to encourage her bonding with her baby to get better outcome. Am I clear so far?
Yes, you are very clear.
We can offer some sort of talking therapy to help her to understanding about her condition and how to get these thoughts, unhelpful thoughts about worrying about the baby has a leukemia, to a helpful thoughts.
Okay.
Some sort of
How can I help her?
the good support from you and your understanding about her condition is paramount. And your support for her is very important, and to make sure that he taking her medication regularly, with regular follow-up with psychiatrist, it can help her so much.
Okay.
And also we can offer occupational therapist to help her to how to bond with her baby, like baby massage, like knotting, crocheting. All of these activities can help her to be more better in her mood.
Okay.
Am I clear?
Yeah.
Do you have any specific concern for me, Mr. White?
No, thank you. Thank you.
Thank you for coming to see me to ask you about your wife, and we have discussed that she is experiencing what is called depression, and we have a lot of options to help her. One of these options can offer her medication, and also we can offer her to be in mother and baby unit for good care for her baby and to improve her mood. And we can also discuss this about psychological support. And do you have any specific question for me?
No, thank you. Time. How do you feel about what you did? How do you feel about what you did?
I start to go directly to management plan before asking about the risk and clarifying more about risk for herself and her baby and about her physical health and past history if she got a past similar episode in the past.
حق ناصر
And I think
ناصر يا بركة انت مش مذاكر. انت مش مذاكرها خلاص. انت راجل بركة وطيب وخلينا نروح انت مع صلى على النبي. ماشي. Okay. Thank you so much. Thank you very much. Okay, so pay attention to the following, please, doctor. As I always say, pay attention to the language. Yes, this is not an English exam, but sometimes there are, mistakes which might not be forgiven because you messed up with the pronouns. You kept saying, referring to his wife, that he. Okay, so you must always talk about his wife as her or she, and this is a language mistake. Okay. Yes, Doctor, it's not what you think. It's just definitely, this is fact. It's not a thought. He must refer to his wife as her, okay, not she. Pay attention. You repeated this mistake several times, Doctor. If your language is not helping you and there is not enough time to improve your language, you can write down the script by your head for this station, or you can have another source with the available material. Read it several times by your heart and be well prepared for the station and avoid these silly mistakes, actually. Okay. Prognosis, when I ask you about the prognosis, pay attention, your answer was not good. And please, doctor, there are some factual information which they are deal breaker. What is the role of occupational therapists here? Baby massage, what is baby massage and crochet? There is nothing like this in any source, with all respect. If you don't know, don't come up with wrong information. It is more honorable to say, I don't know, I'll go back and check the sources, better than coming up with something like this, talking about the role of occupational therapist, baby massage and crochet. This is something which is totally irrelevant. Okay. You are saying I'm a member of the Royal College, okay, or I want to be a member of the Royal College. So you should know better. And when you talk about the medications, doctor, what are the medications which are going to use? What are the mood stabilizers, antipsychotics? What are the medications which you must talk? What are the medications? I didn't hear the medications, antipsychotics, antidepressants. What are the medications which you are going to use? Okay. Okay, let's see. Okay, Bismillah. Let's see how we can do this station. Okay. The first thing you are going to explain what is the problem and pay attention to the emotional tone. The role player will show that he is very worried. Also show the appropriate emotional tone. Okay. And you must mention the statistical figures that this is a common problem affecting 15% of the ladies. Okay. Can also be associated with psychosis. What is the cause of this postpartum depression? You don't say we don't know, but you can say there is no particular cause, but there are some factors which increase the chance of developing it. In between the words, you don't know, but we don't say we don't know. Okay, yes, we don't know exactly, but there is another way to express what we don't know. Okay, there is no particular cause, but there are some factors which increase the chance. Psychological and physical, like cesarean section, etc. Okay, so psychological factors: past history of psychiatric disorder, past history of having postpartum psychosis, family history. Okay, the factors which increase the chance of having postpartum depression here are. Okay, the next question: if there is any risk? Definitely there is high risk on the mother and the baby if the disorder is not managed properly. It is not uncommon that the mother can commit infanticide. They can kill their baby. Okay. Is she going to get better? This is a question about the prognostic factors. Please, whenever you get this question, avoid the empty assurance. They are checking whether you know the prognostic factors for the patients who have psychiatric problems. Typical answer, okay. There are factors which favor the good outcome, like the early start of the treatment, absence of psychiatric history, etc. This is a typical question with a typical answer. But before answering this question, it is better to check for some information to make your answer ideal. You want to know some social and physical and the level of risk, okay, before answering this question. And before talking about the management, you should formulate. And then talking about the management, as I always say, in order to be organized, Dr. Nasser, and in order not to miss anything, you must put your talking about your management plan in an organized way in order to make sure that you will cover all the points. So the first thing, what are you going to do and what the patient is going to, where the patient is going to be treated. So we want to see her again to explain her diagnosis, address her concerns, explain for her the management. She will be admitted in the mother and baby unit after the delivery, where she will be followed up by the perinatal team. Okay. I think no, it's not after the delivery. Now she is going to be admitted in the mother, not after the delivery. This is a typing mistake. She is going to be admitted in the mother and baby unit. Okay. Okay, are you with me, doctor? Sorry for this typing mistake. And then the typical investigations, as long as you are going to use medications, you must talk about the investigations. And then talk about the perinatal team, which will cover all her needs psychologically, socially, and physically. The psychological, you have the medications. You must use a medication which is safe in pregnancy, like fluoxetine, and an antipsychotic like olanzapine, which is safe in pregnancy. Are you with me, Dr. Nasser?
Yeah.
Okay. Physical, you must liaise with the obstetrician. Social, you must arrange for her discharge. Once her mental condition is stable, she will go home and she will be followed up by the perinatal team. Okay, doctor. Very clever. Thank you so much. I hope that you found it helpful. Okay, doctors, as you can see, this task is not easy. Please pay attention to this. Prepare well. Have a good source. And make sure that your reference is the mark sheet. Okay, this is your reference, not your reference that you have you are clustering different sources. It doesn't make a difference. Make sure that your practice and your mark sheet will be your reference, okay? Wish to see all your things in the post list. Have a good night.
Thank you.